back. There are many different ways to go about taking care of our mental health. Forest View Hospital is all about finding the level of care that best fits your needs. Joining us this morning is Dr. Pria Dykstra, Director of Outpatient Services. Good morning.
Good morning.
Well, why don't you go ahead and explain the various types of care that you guys provide, from outpatient to inpatient and maybe anything in between?
Sure. So at Forest View Hospital, we do provide 3 levels of care for our community. We do provide an inpatient level of care for our adolescent and adult population. We do provide a partial level of care that is available for our adults and adolescents. And we do provide an outpatient medication management clinic, which is also here on campus. Our individual treatment plans are all geared towards, finding the need that best fits for the community along their mental health journey to make sure, what is available, what is out there for the community, so they're not looking for something that they may not know how to access. Our inpatient level of care is geared toward individuals that are struggling in the community in their terms of their mental health. They need a little bit more surrounding features that need to help them and gear toward their success in their journey. We provide 24 hours level of care for that type of individual. Our partial hospitalization program is geared toward individuals that are also struggling with mental health, and they're not maybe be able to function in their daily lives. However, they may not need that 24 level of care or 24-hour level of care that our inpatient hospitalization needs. Our partial hospitalization program is geared toward those individuals, and it's available Monday through Friday, 9 a.m. to 3 p.m. And so it's more like a day program, so they can get our programming here in that level of care. Outpatient treatment is also available here at our medication management clinic. Outpatient level of care is geared toward individuals that may be struggling with mental health. However, they're able to go on with their daily life with just a little bit of support. So we are available for all those resources here.
And what have studies shown about the success of your outpatient programs?
Sure, there's many studies out there. It's really important to note that studies have proven that individuals that utilize outpatient services, such as our partial hospitalization program, are more likely to succeed after they have their inpatient stay and their step down, are more likely to succeed in terms of their treatment planning and their aftercare planning. Also has proven that less frequent inpatient hospitalizations are needed in the future. So that's something that we really strive upon and look towards.
How do you go about analyzing what works best for somebody? And I know a lot of people maybe are hesitant to come to you because of the stigma about mental health, or maybe the fact that they're going to get pulled away from their regular daily life and they don't want that to be interrupted. So how do you go about analyzing them or figuring that out, screening them?
Sure. So finding the correct level of care is extremely important for anyone's mental health journey and their treatment and their recovery. We have trained clinicians here at our hospital in our assessment and referral staff, and they're available 24 hours a day, 7 days a week to assist those individuals in providing those services for them to make sure they're placed in the correct level of care. We take pride in that, and we make sure that they're really treated with respect. And we want to decrease that stigma of mental health. It's really important for everyone to have a positive mental health journey, and we try to make that as successful as we can here at our facility.
Well, thank you so much for your time this morning. I know right now, more than anything, you guys are definitely needed. So for more information, forestviewhospital.com, call 1-800-949-8439. Thanks for your time.
Thank you so much.
Absolutely.